Hello, hello, hello. This is Laquita Mondley, and we are live. I'd like to thank you guys so much for joining us today. We're going to give everybody just a few minutes to get in and join the broadcast. And while we're doing that, I'm just going to make sure I step away from the camera for a second and hardwire myself in. I know many people are probably experiencing their Wi-Fi being slow. I know we are here in Killeen.
Extremely.
And I would complain, but I'm not going to complain because I know for our internet service providers here in our area, many of them are providing internet free of charge to families whose students are at home and having to do their schoolwork at home due to school closures for COVID-19. So I won't complain, but what I'm going to do, I normally do this beforehand, so I apologize, but I'm going to plug myself directly into my modem just to make sure that we have that I keep the best signal possible during the broadcast so that we won't buffer. Give me just a second. All right. That should make the signal just a little bit better for us and make sure that we don't buffer. But again, thank you guys so much for joining us. Today is Sunday. It's 5:05 p.m. and I'm looking forward to this great conversation that I'm going to be having with my good friend CoEva. And she's going to be sharing with us today information about COVID-19. I know people are probably sick and tired of hearing about COVID-19. And the honest to goodness truth is sometimes I unplug. I won't watch the notifications that pop up on my phone. I won't watch the news. But at the same time, I do like to be well informed. So I don't want to be bombarded with it all day, every day. But I do watch information from credible sources so that I can help determine the truth from a lie, what advice we need to be following, what things we need to ignore. And that's what CoEva is going to help us with today. And so what I'll do right now is, Ms. CoEva, if you could just please introduce yourself and tell us about your areas of expertise.
Good afternoon or evening. I am CoEva Barnes-Gatlin. I am a family nurse practitioner working in primary care in Macomb, Mississippi.
Awesome. So this the reason that I invited CoEva on is because of her expertise in this area. She gets to see patients on a daily basis, and I know that due to some of the measures from COVID-19, you've also been taking on some additional patients just to make sure that people are able to get the adequate care that they need. And I guess my first question to you, we hear all over the news where they're talking about curbside triage, curbside care, telehealth care, and all of these different things. Can you tell some of our viewers, can you tell our viewers what exactly do those terms mean and what can they expect if that's the type of care that they're given?
Well, specifically curbside triage is for those people that think that they might be symptomatic for coronavirus or COVID-19. That means that they would actually physically drive up to the clinic or the facility set up at other clinics, and they would remain in their car. They would call into the clinic, or they have a person that's already set up curbside, masked and gowned to go out, get information, get vital signs. And if those people are deemed truly symptomatic, temperature greater than 100.4, shortness of breath, chest pains, that kind of thing, then they would warrant testing for COVID-19. Everybody that wants to be tested can't be tested because supplies for testings are not as great as one would think they would be. So testing is strictly limited to those that are truly exhibiting symptoms of COVID-19.
That's a great point.
Now, as far as telemedicine, telemedicine is a platform that is used by providers to actually see patients the way that they see us at this present time. it is effective and efficient for non-complex issues. Definitely, if there was somebody that was experiencing extreme shortness of breath, major injury, they don't need to appoint at a clinic that is truly just doing telehealth. They would need to present to their local emergency room and or urgent care.
Okay. Okay. So, get a little bit of feedback right there. If you could, I guess we've had a couple people on some of my previous broadcasts. We've had several people on some of the previous broadcasts that really want to know, okay, where you were saying where they want to present themselves to their emergency rooms if they're truly symptomatic. Could you go for us, repeat one more time? What are the things that need to be going on with them for them to present themselves at the emergency room versus, you know what, I got a cough, I got this, I got that. Oh, I wonder.
General cough, increased fever, malaise, maybe some GI upset. Those are symptoms that can be treated symptomatically within the home. Okay. It's when you get to the temperatures that are greater than 100.4, that are not being relieved with Tylenol. Shortness of breath, where you truly are having shortness of breath and you're symptomatic, gasping. You want to get to the emergency room before it gets to that point. But if you're just having general fatigue, temperature, slight cough that is not really bothersome and it's not causing shortness of breath, it's not interfering with you talking, it's not interfering with you lying down to sleep, then those kind of things can be handled within the home.
Okay.
Making sure that someone knows that you are not feeling well. You don't want to self-isolate sick and no one knows.
Okay. So we do want to make sure that if we're feeling any particular type of symptoms, that we do go ahead and take the measures to begin to self-isolate, aka self-quarantine. But importantly, the most important thing, we want to inform others, our friends, our family, our loved ones, even our primary care providers, that, hey, these are the things that are going on with me. This is what I am currently doing to self-treat. See if they have any other advice for self-treating. But you don't want to self-isolate, self-quarantine, and not let anyone know what's going on with you in the event that it is truly COVID-19, because someone needs to know where you are, what you're doing, and have the ability to check in on you. Now, I have had a couple of people who have reached out to me and just in conversation where they've received the telehealth or they've received the curbside services at their primary providers, and they were upset about it, like really, really upset.
They felt put off and they didn't feel that it was personal enough, and I can understand that.
Yeah. And can you, just if you don't mind, can you explain the necessities of that to our viewers so that they, in the event they find themselves in that position, that they won't feel put off and they won't feel like they're not getting the care that they deserve?
Well, honestly, because this is a new strain of coronavirus and the intricacies of it is not truly known as to the transmission rate. It is assumed that it is droplet precautions, meaning 3 feet. If somebody speaks, coughs, sneezes, those droplets can spread 3 feet distance. And you want to make sure that you have that distance between you and someone that is supposedly or visibly ill, especially during a time such as this. Now, the true curbside cough and fever setups are truly there to protect the person in the car and the person providing the care. You won't, I mean, it's kind of hard to be personable when you're masked, gloved, and gowned and the person can't see you, but it is to move in a quick fashion. It's not for a stop and sit and talk and do a full intake. It's a quick intake, it's a temperature taking, and a minimal history to see if you've had possible exposures, what your symptomology is, those types of things. So the feeling of that not really being recepted well at those facilities is not uncommon. And sorry to say, I don't know what that I could say that would make that interaction better. It just kind of is where it is right now in what we're standing in.
What we're standing in. So basically, what I hear you saying for our viewers is that this truly isn't a time where it's safe for the patient or the provider to give the normal quality of care if that person is presenting themselves symptomatic or not symptomatic, because there really isn't a certainty of how this thing is being transmitted. You know, we have a great idea. We have a great idea, and because we have a great idea of it, that's how the COVID-19 is being treated, that it is droplets. And so because that's the best hypothesis out there right now, that it is droplets, then the providers are providing care according to how not to themselves to become sick as well, if the patient truly is sick.
Correct. In general, most clinics don't have full PPE set up. Honestly, I'm just going to be honest with that. And right now, getting them is almost nil. I ordered gloves and masks. Now I keep gloves. I keep a few masks. But currently, I have no mask other than a couple homemade ones. And I have a few gloves, and I have ordered, but delivery dates is so currently expecting gloves in May and possibly new mask mid-April.
Yeah. So it's not so much that the healthcare providers across the country are not doing what they should do. It's because there's just extreme shortages. So,
there's extreme caution, and then there are shortages of the provider equipment that we need to actually interact appropriately or on a different level than just curbside. Because if that person is truly positive with COVID, there is specific cleaning that has to be done. You just can't go in and hit and miss here and there. You have to do a little more deep cleaning of your exam room, of your facility, and that can become expensive.
Yeah. And the cost of it, as well as, again, the ability to get it, you know.
Correct.
I'm more than sure that healthcare providers across the country, you guys are in this field because you love to help people. And so having to figure out how best to help your patients while yourself remaining healthy, simply because I can't get access to what I need, has to be a very frustrating position for
the provider and the patients.
For the patient and the provider. So this situation is one that it's not just frustrating on the side of us as patients, but it's also frustrating for providers as well, with not being able to do what you know you want to do or can do for your patients.
And the thing with me personally, I'm a hugger. My patients are huggers. So to have to see them via video is hard. It's good to see that they're healthy, but there is no physicality there. There's no interaction other than me being able to see and speak to that person. Now, then you come along the guidelines of vital signs. I do require that most of my patients have the availability of a thermometer and a blood pressure monitor in their home. That's just me. So those two things I have been pretty much able to get. Basically, you're not seeing any sick patient via telemedicine. It's just general follow-ups, those that are diabetics, those that are hypertensive, and with just the general sniffles, cold, that kind of stuff. That would not require a total hands-on visit.
Okay. So these are things, I've seen so many different things in the news where different types of physicians are being asked to push off appointments, different types of surgeries and procedures that will be normally going on right now. They've been asked to reschedule. And could you explain to the audience why that's happening?
Because in order for the person to come into the office, that would mean scheduling. And generally, when you schedule, you don't schedule just one or two people. You have a full daily schedule in order for your business to function and profit. So you're going to have a waiting room of people. And then there's going to be close. You can't social distance. And there's just an increased risk of cross-contamination and everybody getting infected. You never know who's sick, because a healthy person can actually carry and not get sick, but they can still pass it on to someone else that has a lowered immune system. So
Yeah,
it's
that's
just safe.
that's a great point. That's a great point. We had it. I can't remember what day this week it was. It was earlier in the week where we had a wellness expert, and we had a registered nurse on as guest. And because we had a couple of people on that particular day that were concerned about the validity of the level of concern that's being presented for COVID-19, whether we should be as concerned as we are, or whether this thing is being blown out of proportion.
We
But the
should
way
be as concerned as we are because this disease specifically attacks the lungs and it can cause adult respiratory failure. And in this country right now, we are very limited and short on the presence of ventilators. So if we don't take these precautions and more unhealthy, and we know that we have an unhealthy unhealthy environment, our people are more unhealthy these days because you've got those with diabetes, you've got those with COPD, you've got just different lower immune systems, cancer, people that are currently undergoing chemotherapy, anything like that will lower or could lower the immune system of a person, and you don't want to put extra people at risk when you don't have the adequate equipment to treat multiple people. I mean, there are people that they're having to choose who's the sickest and who should get a ventilator and who shouldn't. So we don't want to continue to place those that are on the front lines, those pulmonologists and those critical care doctors, in a place to have to choose who gets the ventilator and who doesn't. Right. That truly.
I can't even imagine the type of stress that those men and women carry on a day-to-day basis, because in God's hearts and minds, one life is just as valuable as the next life. You went into these fields to save lives, and then to have to make that decision based off of the availability of equipment,
right?
With a situation that can be contained. I mean, I'm not saying we can totally eradicate it, but it can be slowed down.
Right. That leads to the imperativeness of people self-isolating, of people staying away from crowds that are greater than 10, not visiting multiple places, only going out when you totally have to, making sure that hand hygiene is stressed. For those that are working in the medical field, for those that are working out in the public, period, don't wear the clothes that you wore out around your house once again. Take them off, throw them in the washer, shoes in a bag. Because droplets can live different lengths of time on different surfaces. That includes your hair. So your hair, your clothing, your shoes, your body. So anytime you have a virus that is transmitted through droplets, you need to make sure that you are protecting yourself, not only in your place of employment, in your car, in your home, because you don't want to take it into your home and risk the lives of your loved ones.
Oh, that's some great information. We do have a question here. One of our viewers asked, if going to the ER for something other than COVID-19, should a person protect themselves by wearing a mask?
I would say so.
Okay.
I would say so.
Yeah. Because if you're in the ER, then you're obviously in the ER because I'm real sick. I might not know what's wrong with me, but I'm real sick.
That should be the case, but that's not always the case. A lot of people use the ER for a doctor's office, which is not good either.
Okay. Fair point. So the importance of, you've talked about the importance of social distancing right now, and how that is something that is absolutely beneficial to not only the individual, but it's also beneficial to the people that individual loves and cares for, and comes into contact with. I think if I remember the terminology correct, Lauren, who was the RN that was on here last week with us, she was talking about that's the importance of social responsibility. That each of us has a social responsibility to those in our communities, on our jobs, that we'll come in contact with, not to unintentionally.
Correct.
This isn't. I don't believe that this thing is circulating through malicious intent.
No.
A lot of people, like you said, they can be carriers of it and don't know because they're not presenting any symptoms,
right,
yet, or if ever. But that does not mean that they cannot go ahead and carry that that virus to someone else.
Right. Now, we could all be a carrier and never get sick, but for those that are at a greater risk, and when I say never get sick, I mean like we just feel like we have a little cold. But for those that are immunocompromised or have comorbidities that increase their risk of getting COVID-19 or coronavirus, we as people have to be more aware of our responsibility, our social responsibility to our fellow man, and with greater social responsibility for our elder. Because for those that have or live with a grandparent or have kids that grandparents babysit, you have to be very, very aware of your surroundings when you're out and about and you go into that person's home. So it is very important that we take precautions to prevent the spread by social distancing, by hand washing, by staying at home if you feel bad or poorly, and notifying your primary care provider that I've got X, Y, and Z symptoms. What do I need to do? And at that time, they can decide if you need to at least be seen via telemed or come in so that they can physically see you. Now, the option of actually going into a clinic is not out of the way. It can still happen if that person feels comfortable enough with those presenting symptoms for that person to grace their doors.
Okay. So that social responsibility is something that each one of us should be taken quite seriously, so that we don't unintentionally put our loved ones at risk. You made a very good point of the elderly, of our children, and of our friends and family and loved ones who are immunocompromised. Because when you hear that term immunocompromised, I'm not sure if everyone that hears that term absolutely understands what that means. I think, like, on a few conversations that I've had, when I say that term, some people will, my loved ones aren't sick. They don't have this. They don't have that. They're thinking of something that would cause them to need to be in the hospital already, or at some type of care facility as inpatient. But immunocompromised could be someone with asthma.
Correct.
Because like you said, it attacks the lungs.
Correct.
And what can you just, if you don't mind, just really give us a layman's understanding of when the healthcare professionals say immunocompromised. Explain to the audience, please.
Immunocompromised does not necessarily just mean the disease process itself. A lot of time medications can lower your immune system. So for those that are diabetic, they are immunocompromised. For those that are with lupus, they are immunocompromised. For those that are with sarcoid, they are compromised. These people are compromised not only because their body does not fight diseases the way that the normal healthy person would, because they are already predisposed by the attacks of that disease process on their systems that makes it harder for them to fight off illnesses. So they don't have to visibly look sick. I don't look sick. I'm a diabetic. I don't look sick. I have lupus. So I have two disorders that put me at a greater risk, and I'm not elderly, but I'm not young. So it is important and imperative for me to protect me, as well as me to protect my patients.
Right. Right. So, and again, immunocompromised, for those that are watching, it does not mean that that loved one or that person that you know presents physically or visibly sick. It means that they have something that's already going on with them that makes their immune system vulnerable, whether it's through the medications that they're taking in order to remain healthy, or if it's from the issues that's causing them the need to be able to take the medications that could quite possibly be making them vulnerable. So immune compromise, that list is quite extensive. You
It
know,
is.
as you said, we in America, we're not known as being the healthiest nation on the planet, unfortunately. And so we do have a large population of individuals who can fall in that category of having of immune compromised people. And as you said, that doesn't just mean old people or babies, young people, middle-aged people. It has no socioeconomic status on it.
And another thing is they are finding more healthy people are becoming positive. I have a friend that works in an ER in Atlanta, and she posted a status reporting that they are seeing 20 to 40-year-olds come in, not just positive, but really ill, like really ill with no underlying health condition. With no known underlying health conditions. Let me make that statement that way. But that's all the more reason for people to not just brush this off and take it lightly. I don't like staying at home. I don't. I miss going to Applebee's with my friends. I miss going to church on Sundays. So I don't want to stay at home, but I would not tell you to do something that I would not personally do for the better or the protection of the health of not just my community, but of our nation. People are dying.
Yeah. I was telling my son this morning, I got up, my morning routine every morning is get up, grab a cup of coffee, but I leave my house to do it because my office is in my house and I have to get out. Like I need a point in my day where I get out. And since we've been practicing self quarantine, I haven't been able to do that for the last couple of weeks. And this morning I was like, oh my God, wait a minute. I FaceTime both of my older sons. Was like, look, like your mama going through withdrawal. This ain't good. But did that mean I got in my car and jumped out and went somewhere? First of all, my city's on orders to not go out. So all of our restaurants are closed. So I couldn't. But no, I didn't. Because at the end of the day, I want to do what's best to make sure that my family and my loved ones are healthy and remain healthy. And that's a social responsibility that we have. That's a responsibility that I have as a mom, as a wife, as a grandparent. I don't want my need to go be a social butterfly and get a cup of coffee be the reason that my family comes into contact with something that I totally had the ability to prevent from happening. And what it does, it's exposing a lot of selfishness in the heart of Americans in general, because at the end of the day, a lot of reasons that people aren't following the rules is for their own selfish reasons. I want to do this. I want to do that. My family needs this or my family needs that. Even while we're having shortages in our grocery stores, people are extremely, extremely, extremely selfish. Yes. Do we need to have the things that we need in our homes? Absolutely. But we also need to
have to be mindful of others.
Yes.
And we also have to put ourselves on schedules, our children on schedules, because we don't know how long this is going to last. And it is already proving that there are shortages.
Mm-hmm.
You sure you can't find a loaf of bread?
Exactly. Girl, I told my children the other day, I had to bust out the Vitamix. I bought the Vitamix a few years ago when, my mind told me I was going to be making all these healthy smoothies and drinks. I did it for a little while, but not a lot. But one of the things that my Vitamix can do, it can make bread. It can knead bread dough. Mm-hmm. So that was some of the features we played with it when we were in Germany, and it can knead bread dough. Because if I can't find no bread, I got to do something. They need a piece of bread. Bread is a staple item. Rice is a staple item. You know,
Yes.
you have to be able to have these things. So, just take a minute to thank everyone for joining us again. We've had quite a few people to come onto the broadcast. Thank you so much. I am your host, Laquita Monley, and my lovely guest this afternoon is Miss CoEva Barnes-Gatlin, and she is a nurse practitioner with her own private practice there in the city of Macomb, which is located in Mississippi. And she's on today sharing with us helpful tips on how to remain safe during the COVID-19. She's also helped to dispel some erroneous thought patterns in terms of how COVID-19 is spread, who can get it, who can't get it. Do we need to social distance? Do we not need the social distance? She's provided us with so much great information today that I hope you guys who've joined in, please join the conversation. Feel free to post your comments, ask your questions. We'll be happy to address any of those concerns with you while we're live on the broadcast. And once the broadcast is over, we'll address any of them in the comments that you leave as well. If you're watching this video via Facebook, please like and share, like and share. Let's get this information out to our friends, our family, our loved ones that need to hear how to make sure that they're healthy, how to boost their immune system, which is going to be my next question for CoEva. How can we boost our immune system? If you're watching us on YouTube, please subscribe. And if you're watching us on Periscope, please like and share.
Limit your alcohol intake. Increase your vitamin intake, specifically vitamin C, antioxidants, those types of things. Getting plenty of rest. Hydrating, water. Preferably more water than sodas, preferably more water than juice, but hydrating. And eating healthy. During a time like this, we are prone to grab whatever is available. So it's important. Rest, diet, hydrating, and vitamins and antioxidants. They help to assist in boosting.
I know that a lot of people across the country are stocking up on canned items, and this is just a personal pet peeve of mine. I don't like canned vegetables and fruit. I don't. I mean, I bought them and ate them when I had to, but now with a preference, a choice, I don't, because I know that they're not as healthy as frozen or fresh. So if you're finding yourself in the stores and you can't find things in a can, that might be a blessing for you, because in order to boost your immune system, to get in those vitamins, those minerals, those antioxidants that CoEva was discussing, fresh fruits and vegetables are the way. And being a country girl from Mississippi, somebody's grandmama, great uncle, somebody somewhere got a garden. Visit the garden, pull up some vegetables. That's what we need. That's what we need right now. Now, you did mention antioxidants. What are some of the things that the viewers can add to their diet that are rich in antioxidants?
Blueberry, raspberries, blackberries, those types of things are high in antioxidants. Healthy antioxidants.
Healthy and what about vitamin C? So if I went to Walmart, there were no vitamin C left on the shelf because everybody took them. You know, what are some of the things that help me increase what you would recommend as a daily dosage of vitamin C? What are some things that they could add to their diets?
Fruit. I mean, most oranges, that kind of thing. Pineapple, believe it or not, those types of things.
Okay. So lots of fresh fruit, lots of vegetables, and eating that healthy, balanced diet is what's best for boosting your immune system. We do have a question. One of our viewers wants to know, do you think that all of this will be over by Easter?
Baby, whoever answered that question, I have no answer for it. I can say that we can pray for this to cease, pray that God moves and works. But as far as person, the best way to do that would be for people to truly, truly, truly follow the mandates of self-isolation, self-quarantine if you're sick. Don't go out unless you absolutely have to. That would decrease the spread and possibly increase the time frame or decrease the time frame that it'll last. But as far as me being able to say yes or no to that, I can't.
Yeah. 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 I know I've heard on many of the different news stations where I get notifications, everybody has an opinion. And I think that a lot of those opinions, basically from politics that have been giving that Easter time frame, is not based on the health of the nation. It's based on economics.
Right. Because if they stay shut down any longer than they are,
yeah,
that month time frame will really do some damage to the economy.
Yeah.
I mean, it's already happening. I have friends that are closing businesses, and this has only been going on for 3 weeks.
Yeah.
So if you add an additional month to that, it could be bad for the economy and bad for the nation. But we have to do what we have to do. And if people had heeded the original warnings or the original request of staying inside, no large group gatherings, limiting your direct contact with other people, it's quite possibly that we could be on the downside of it. But currently, the cases are growing exponentially by the day.
I was going to say that as a business owner, I do understand why other business owners, especially small business, major corporations, I got an opinion on that one. And it is, if you are a major Fortune 500 company, Fortune 100 company, you're a major company, that's a discussion for another day. This should not be negatively impacting your bottom line. It might be negatively impacting your CEO's paycheck. But your regular employees should still live to fight another day. There should still be money there. But again, that's my opinion. As a small business owner, I definitely understand why this is a negative impact on the small business owner. And the truth of the matter is, it's not a Republican issue, and it's not a Democratic issue. It's not a political party issue. It is the way that our economies are set up. It's the way that our capitalistic society is set up in America. And that is why our businesses are suffering the way that they're suffering. Like I said, that's the whole subject for another day and another time. But as a business owner, I can understand why many business owners are wanting doors back open. The only drawback to that thing is we can really, as a nation, we can jump up and we can get back to business as usual.
And be right back where we started.
We'll be right back where we started, if not worse. So it's one of those situations where the best decision to make, it's still going to cost you something. It's just, how much is it going to cost me at this point? If
I have to close the business and end up with my life, I can open another business. But if I reopen my business before things have really and truly made it to the downside, then I'm risking my life. And if I die, I don't have a business or a life.
Exactly. We have another question from a viewer. They want to know if we agree with people that are saying that our government has failed us in the United States. And I'll give my opinion on that. And my opinion is this: again, this is not a Republican issue. It's not a Democratic issue. And the reason that I say that is we live in an age where information is so accessible. It is extremely accessible to us as people, to whether it doesn't matter if you are a Democrat, a Republican, an independent, whatever political affiliation you go with, you have the ability to hear news from both points of view. We have the ability to hear news from different parts of the world. It is each of our individual responsibility to hear the information and make a decision. I didn't, for myself, my family, I did not wait for the state of Texas to tell me to self-isolate. I did not wait until the city of Killeen put in that order. I know that I have a daughter that's pregnant, and I have a 2-year-old grandson, and I am a believer, Holy Ghost filled believer. I do not operate in fear, but I do operate in wisdom. And with the information that I had access to, it told me, Quasha, you want to limit what you do, because I don't want to inadvertently give, I'm healthy. I don't want to inadvertently put Denise at risk because I like to move around. So with my business, I'm very fortunate that my business is one where I hire people to work from home. So I don't have to interact with my contractors except for via video. So the things that we could control, we controlled it. And that was a personal decision. So in that instance, if you're talking, if I'm understanding the question correctly, if you're saying, did our government not shut down when they should have? At this point, yes, that's a valid question, but we are individuals. I don't have to wait on my government to tell me to do something that I think is the best decision for my family.
And if you're basing it on the ability to continue to bring in income, again, I go back to if you lose your life, you still can't bring in income.
Yep. You can't. Again, this is a conversation where, yes, politics do play a role. Our government does play a role. But I think that, and this is just my opinion, CoEva, you jump in anytime. I do think that when it comes to my health and my safety, the health and safety of my family, when there are things that we can do as individuals, then we do it. Now, I do understand that not all companies around the country are allowing their people to telecommute. And quite frankly, I know like Senator Barnes there in Macomb, if you're working out there on that line, you can't telecommute, right? I mean, it is what it is. If you're a factory worker, there are certain jobs that just won't allow you to telecommute. And I do understand that in those positions, we do need the support of our federal government, our local and state government to put pressure on employers to do the right thing for their employees. Now, on that, yes, I do think that our governments as a whole, Democrats and Republicans, need to put aside their differences and come up with what they call a bipartisan agreement.
Right.
Look, people need to be healthy, and this is what we need to put pressure on these major corporations to do. And this is how we need to support them. But at the end of the day, simple things like social distancing and stuff like that, we do have the ability to make that choice and what we can do for our families. Yeah, so I don't know. I hope I answered that question for our viewer. If not, please feel free to jump on in again. Restate the question, because I know sometimes you lose, you don't quite get the full understanding of what a person is trying to say from a typed comment. But yes, we had several other ones that say, one of our viewers says, no one wants to be a prisoner in their own home, but at the end of the day, we do have a social responsibility to not go out unnecessarily and to put us or other families at risk. Yep, we're all bored.
Correct.
We are all bored, but there are things that
there are things you can do. This is a time for self-reflection. This is a time for spiritual growth. This is just a time to learn who you are.
Yeah, absolutely. We have another comment that says, this individual says she read something somewhere where the president just extended the social distancing through April 30th. They're not sure of the details on it. That was my first time hearing that. So that's something that I look up after the broadcast are over.
They just had a press conference since we've been on. So it might have happened then. Yeah,
that might be it. That might be it. So, this has been a great conversation. We will have to definitely do this again. For those that are just joining us, Ms. CoEva Barnes-Gatlin, she is a nurse practitioner with her own private practice in the city of Macomb, and she's been sharing great information concerning COVID-19, the importance of social distancing, and she just really spent a great deal of time with us today dispelling erroneous thoughts, telling the truth of what COVID-19 is, and why people are experiencing what they're experiencing from their healthcare providers in terms of curbside triage, and why everyone who wants to get tested can't get tested. And, she even shared a lot of things with us today about what the stress levels of the providers with the shortage of the equipment like ventilators, and where, people are having to make decisions who gets the ventilator and who doesn't. And a lot of times, some of these things, the spread of this virus can be prevented or it can be slowed down if we do simple things as proper hygiene, social distancing, self-isolation. And for those of us who aren't sick, let's do our best not to get sick by living healthy, eating healthy, and following the instructions that have been put out by the experts.
And it is true that Trump did extend 30 days.
Okay.
So during that 30-day time,
which is really good.
It is more than okay to go out on your back stoop, your back patio, but you don't want to go to the neighbor's house. You don't want to chill and do a barbecue. You don't want to do any of those things. Getting fresh air, put a mask on, but get outside if you can, if you want to, but you don't want to stay outside for extended periods of time. I would not recommend that.
Yeah. So we all have to do our part, and we have to do what we feel is best for the health and safety of ourselves, our friends, and our loved ones is the bottom line. For those who are watching the broadcast, if you are, of those individuals in that thought process of, oh, this is only happening to sick people are making this bigger than what it is. We had one guy says, well, this is no different from SARS. And well,
it is.
No, it is different, It's not, it's causing a lot more issues. And I believe it's because people are ignoring what they should be doing.
Well, a lot of people are under the misconception that coronavirus is on the back of the Lysol can. It's been here. Yes, a different strain of the coronavirus, and there are multiple different sublevels of coronavirus. But this one, COVID-19, is a different strain, and it specifically attacks the lungs. It can cause bilateral interstitial pneumonia. And you put that in a healthy person and it can bring them down. You put that in an immunocompromised person and it will possibly kill them.
Wow. Can you repeat what type of pneumonia is that?
Interstitial.
Interstitial, okay. So what does that mean exactly?
It is, I would actually directly have to, it's just a more severe pneumonia.
Okay.
And it just is not easy to get over. And it almost just totally makes the lungs unfunctional.
Wow.
That's how people end up on a ventilator.
Wow. Okay. We have one other question before we wrap up, because I'm doing a back-to-back live today. My next live will be starting in just a few minutes, and we'll be talking to a panel of educators from some from there in Macomb and some from here in Bell County in Texas, and some homeschool moms. And we're going to be addressing, hopefully, and bringing some encouragement to the parents who have found themselves in a position, oh my God, I'm homeschooling. What am I doing now?
I so thank God mine are grown.
It's we have one left in school, and he's 17, and because we are previous a homeschool family, it didn't really shake me. It was just, we're going to go back. But I know that's not everybody's case. So hopefully, prayerfully, the people who will be tuning into our next broadcast will be able to find some answers and some comfort on how to be successful during this time of school closure while we are being the educators for our children. But the last question that I'm going to address right now is one of our viewers says, other than social distancing and personal hygiene, is there anything else that we can do to help to stop the spread of the virus?
Stay home. It's just as simple as that. Make sure that you are limiting what is going in and out of your house as far as necessities, bread, water, food. You have to literally ration it. I mean, you don't need to be out if you don't have to be. And the majority of people are out because they're going to stores because they ran out of this. So you truly have to schedule breakfast, what you can have for breakfast, how much you can have for breakfast, snack, what you can have for a snack, limit to one plus a fruit and or a vegetable. what you can have for lunch. I mean, you have to set boundaries in order for things to last. So you're not having to run out to the store every other day for bread and or water or fruit and or vegetables. You can't just have a free for all day where you get hungry and you go in the kitchen and you're finding you something to eat. You're going to have to truly stick to a schedule. So the only thing to decrease the risk and the spread is to stay away from people. It's just as simple as that.
Stay away from people. And what it sounds like to me, you just said was people have got to learn how to be disciplined.
Yes. Yeah.
You have to learn how to be disciplined.
Well, in our nation of right now, people have lost that discipline. So it's time to reintroduce it into the lifestyles and in the homes of our nation in order to save our nation.
Reintroduce discipline. Wow. Now that's a great story for another broadcast. Reintroducing discipline in the lives of the American people. It's helpful. It's very, very helpful. It's very, very helpful. I was talking today. My son went out and he put some things on the grill for my family. And normally that means everybody gets to come over and we can just pick out and do whatever. But, you know, I've got 4 adult children here, 1 grandson and me. And, you know, you can't just walk in the store and pick up something because you ran out of it. You can go to get it, but don't.
And it might not be there.
It might not be in there. So, you know, what you said, I've got to actually, I had to start thinking about the meals and where I would used to, okay, this is something we ate it once or twice. I ain't gonna, you know, we done with it, we put it out. No, we're gonna put that in the Tupperware and put it in the freezer. We're gonna eat this again and again and again and again because again, it's not something that I'm doing out of fear, but it's rational, it's logical. Yeah, it's exactly. It's rational, it's logical, it's what we need to do because if it's not in the store anymore, no matter how many times I go, I can't get it. So
and every time you have to go, you're putting yourself and others at risk.
Yeah. So it's reintroducing disciplines. I would love to have everybody over right now for a barbecue because I've been bored for a couple of weeks now. And not just so bored, I've been in the house.
Correct.
So would love to have that, but that's not something that's going to happen. So he just put a few things on and the moneyless will be enjoying his chicken here shortly.
Well, we're used to going to my mom's every Sunday after church.
Yeah.
We haven't done it in 3 weeks.
Yeah.
And it's been hard.
Yeah.
So
we do a family breakfast every Saturday morning. And we have this one spot that we go to. We kind of alternate sometime, but we haven't been able to go. Now, does that mean my family's not together? No, we're self-quarantining. We're together. But it's something that we love to do that we haven't been able to do. And my 2-year-old grandson, he'll say, he'll call French toast bread. And so I fixed pancakes for breakfast yesterday.
That's not what he wanted.
That's not what he wanted. He wanted to go get the French toast because that's what he's used to doing. We'll go out and he'll get some French toast or catfish breakfast or whatever. But like you said, for the last several weeks, we haven't been able to do the things that we normally do. But this too shall pass. We just have to be able to be mindful of the precautions that we've been told to take and be disciplined enough to follow those precautions until it's safe to do otherwise. And we will get back to that place where we can visit, we can mingle, we can go out and about and hang out, and we can do all those wonderful things without being at risk. So, but until that time, then we need to just discipline ourselves to do the things that are necessary in order to remain healthy and to minimize the spread of COVID-19 in our country.
Correct.
Well, awesome. Is there anything else that you would have to give to our viewers before we leave?
Not anything that I can directly think of.
Okay. Well, guys, thank you so much for joining us today. It's been a pleasure. It's been a great conversation. Thank you for everyone that has added value to this conversation, for all of the questions and the comments. I know I didn't address all of them on the live right now, but we will go back through those comments and questions and give answers. If we have answers to give, we'll definitely address them though. But those that are that are staying tuned in. It'll be just a brief little intermission, and I'll come back on with our panel of educators and homeschool moms that will share some amazing tips with us on how to be successful during this time of school closure, that we can do it. Parents, we can do it. Working parents, we can do it. Single parents, we can do it. We absolutely can do it. All right. Take care.
Thank you, Ms. Conway.
No problem, dear. Thank you. Take care.
You too.
Bye-bye.
Bye-bye.